So welcome to EmpowerHer. I'm Stacy. I'm the center manager at Options Women's Care, and I am joined by two of my favorite coworkers.
And I'm Darcy, the nurse manager. Stacy is our center manager and the boss lady, so she bosses us around, doesn't she, Sue?
She does, and I'm Sue. I'm the administrative assistant, and actually they both boss me around.
But we all know who the bossy one is, right, Darce?
Someone has to be.
Well, welcome to our first episode of EmpowerHer from Options Women's Care Center. Our hope with this podcast is that we will empower women to take control of their health by providing them with medically accurate information that is needed to make a decision about their pregnancy. Each month, we plan on covering a topic regarding women's reproductive health.
Well, great. Thanks, Stace. So what is today's topic?
Today's topic is, what is Options Women's Care and why is it important? So Options Women's Care is, or OWCC if you want to call it that for short, is your first step when facing an unplanned pregnancy. We have licensed medical staff and trained advocates to walk alongside women in our community. We're located on Peck near downtown Muskegon.
So what are the services that you offer?
We offer pre-abortion screening, which consists of pregnancy test, limited ultrasounds, and STI testing and treatment at no cost to our clients. These services are performed in a non-judgmental caring environment.
That's great. Well, my next question is for Darcy, because she is our licensed medical staff extraordinaire. Darcy, why is it important that a woman comes to Options Women's Care Center before having her abortion?
That's a good question, Sue. Before getting any type of an abortion, it's important to come to us because we can provide answers that help women protect themselves. Women need to know the following before having an abortion. They need to know location, viability, their gestational age of the pregnancy, and their STI status.
Okay. So you said location of the pregnancy. What do you mean by that?
You want to confirm whether or not your pregnancy is in the uterus. And an ectopic pregnancy is when your pregnancy implants outside the uterus. It is not a viable pregnancy, meaning that it cannot survive outside the uterus. It can be life-threatening to you if it ruptures.
Wow, that's a little scary, so it'd be important to know that.
Yes.
Another thing that you had mentioned was viability. So why are we checking for viability, and what does that mean?
Viability means that you have a sustainable pregnancy. So 30% of all pregnancies do not carry to term. 80% of all miscarriages occur in the first trimester. So we would hate for you to go and pay for something and go through a process that you don't need.
Yeah, no one wants to pay for something they don't need, for sure.
No.
Good point. Now, gestational age. What do you mean by gestational age? Why is that important?
Gestational age is how far along you are in your pregnancy. This will help determine what type of abortion procedure you're going to need. If you have not determined that from an ultrasound, then you can put yourself at risk and even further unnecessary complications.
So those three make sense, the location, viability, gestational age. But why is it important to know your STI status, and what does STI mean?
STI means sexually transmitted infection. There are STDs out there, but infections, it's vital to rule those out. Those infections can set in your vaginal canal. The instruments that are used for an abortion can introduce that infection up into your uterus and can cause further complications. So pelvic inflammatory disease is one of those where it affects your reproductive organs. Women who take the abortion pill as well may still need to have a surgical procedure because the abortion pill failed to empty the uterus. So
That can happen?
it can, and it has happened before. So
Okay. So Options Women's Care offers this pre-abortion screening at no cost to our clients, and it equips women to take control of their reproductive health with medically informed facts about their pregnancy and information on all of their options. And we've been doing this now since the end of July of last year. So Stace, my next question's for you. What are clients saying after visiting the center?
Well, each client comes in, they fill out an exit survey, and they like to leave us little notes at the bottom. And we had a lot of notes to choose from, but these were the ones that really stuck out to us and spoke to us. So they are, I love and appreciate the free care that is unbiased. They make you feel safe and comfortable. Very understanding, helpful, and compassionate, non-judgmental. Very friendly, no matter your choice. Lovely atmosphere and wonderful ladies willing to help, give info, and answer questions.
That's some really great feedback. And I heard something really special just happened recently. Could you share?
Yes, we had a young lady who came to us and was going through the decision-making process. Then that was months ago. She just recently came back and gave us a card that was handwritten and said how much she appreciated us and the care that we gave her during that time. So it was very special, brought some tears to our eyes. So.
Absolutely.
Well, I think that wraps it up for us, and we appreciate you for tuning in to Empower Her. Tune in next month as we cover another important topic about women's health.